Melanie. I'm the registered kinesiologist at EPA in Acton. I teach the GLAD program. What is the GLAD program? Well, let's step back a little bit. How many of you are of the 6 million Canadians that suffer from osteoarthritis, pain in the knee or the hip? Let me guess. Going downstairs, going up curbs, it's kind of painful. You don't trust yourself, so a little bit of instability. Feeling really stiff getting out of bed in the morning, sitting up for long periods of time at your office chair, you go to stand up and you can't stand. You know, a couple of minutes later, half an hour later, nothing ever happened. It's all good. Does this sound familiar? Do you have pain on rest? Do you have pain maybe at night? Is it unspecific pain? You haven't done anything. It's just kind of there. You went to your doctor and your doctor said, let's try a little bit of a paracetamol, which might be an aspirin, a Tylenol, or maybe something more specific like an NSAID for anti-inflammatory problems. That's not the word.
That's okay, keep going.
Keep going? Okay. For inflammation, for control of inflammation. Let me guess, those aren't working the same as they used to. Well, what do? This problem is not atypical to you. It happens all throughout Canada, all throughout the world, which brings us back to GLAD. A decade ago, some very intrigued professors at the University of Denmark had this hypothesis. How do we decrease the lost time? How do we increase quality of life? How do we make differences in people's abilities to do the things that they enjoy doing? Thanks to the insight of Professors Eva Roos and Sven Skov from the University of Denmark, they had this hypothesis that, let's get people moving and see what we can find. The differences that they made in people's quality of life, the decrease of medications that people needed, the increase or the decrease of lost time at work or familiar functions was significant. So significant that they thought they could bring this to the world. So over the last 10 years, we have 8 international countries throughout the world that are helping provide research to make this program a little bit better. Canada is one of them. Interestingly enough, currently the United States is just doing a piloting project to see if it helps them as well. What they have found is in trying to treat osteoarthritis, they were treating the symptoms and not actually the cause. So they were treating the pain, and they being our healthcare practitioners, let's get you a knee replacement. Do you know in Canada, only about 10% of people with knee osteoarthritis actually do require that replacement? If that's the case, then how do we do that? That's what GLAD's developed. So what the researchers in Denmark have discovered is, and it's working in Canada, education, exercise, and weight management makes a huge impact on this population group. So by losing 1 kilogram or 2.2 pounds, we can actually reduce the stress to that joint by 3 to 5 times just because of that simple weight loss. Weight loss is not easy, but if you know that and you have knee pain, it's a little bit of things that you can think about maybe trying to alter or to bring into your life. The education is teaching you exactly what osteoarthritis is doing. It's not just cartilage, it is the entire joint. So we want to look at the stability of the ligaments. We want to make sure that our muscles are nice and strong to offset the load that are maybe absent or diminishing cartilage is not able to sustain any longer. So from that, the GLAD program itself is a 6 to 8 week program. It involves 3 steps. The first step is coming in to meet with a physiotherapist to get an assessment just to make sure that you are an appropriate candidate. There are some people that unfortunately do have bad OA of the hip and the knee, but they also have some other underlying conditions that need to be looked at before they be suitable for this program. We want to make sure that you're safe in continuing. The second step is the education component, where you come in for 2 visits of about 90 minutes and we just talk about arthritis. What is it? How do we manage it? What are some of the modulators that we might be able to use? So do we need to suggest a gait aid for you? Do we need to suggest talking to your physician about a pain modality of some sort? Or do we just need to put ice and heat, make you aware? So again, those are 2 90-minute exercise classes. Then from there, we're going to partake in 6 to 8 weeks of an exercise therapy class. It's supervised because the research has shown that we do very well in a supervised class with others. We pick up tips, tidbits, things that we wouldn't necessarily do on our own via Zoom. The exercise classes themselves are twice a week, are encompassed in about 60 minutes, continuing for the 6 weeks. Again, research has shown if you are able to do this class once on your own independently, your results will be better than they are doing the program as we've outlined. The third component, and the very important component, is this GLAD program is an ongoing research study. So we encourage all of our participants to participate in this study. You log on, you give some personal identifiers, nothing that is shared outside of the UHN, which is the Toronto University Health Network, and they collect all those data. And at the end of the year, it's submitted to the University of Denmark for their compilation of the International GLAD organization. From that, they can determine whether the program is suitable, whether we need to make some alterations, or we just continue. So that's a really, really important component of this. You may choose not to partake in the questionnaires and the surveys, and that's completely fine. There's no pressure. However, you do have to register to say that you are doing the program. Okay. So when you come in for your exercise program, we make sure that you're wearing appropriate clothing, so something comfortable to work out in. Appropriate shoes, so it has to be a running shoe or running style shoe, no open toes, no sandals. We will provide you with the exercise bands, the exercise logs that you will continue to mark down, your dates of program, what you've done, the numbers of your sets and repetitions that you did. So you can look back on it and say, wow, you know what? I don't think I got very much out of this program, but at the very beginning, I could only do 5 sit to stands, and look at me now, I'm doing 30. Sometimes we forget we had progress. The first part actually is before you come in for your exercise, we encourage you to do 10 minutes of warm up. It's to get your muscles moving, your heart rate up and ready for activity. Then we do the 4-stage exercise programs where you'll do 2 exercises in each station. And then we cool down at the end with some simple stretches that you're able to do at home and just some walking to loosen up muscles. Looking forward to seeing you all at the next GLAD program. We're going to do the outer thigh muscle. You're going to feel it we want to target the bum. So if our foot is too far forward, we're going to feel it more maybe on the lateral component of the leg. And if our toe is leading outwards, we're going to feel it more in the quads. Remember where we want to feel this exercise. It is the outer hip or bum muscle. Okay, going to stand nice and tall, utilizing your core, nice and tall, long and lean. Pushing out. Good. The only little correction I might make, bring it back, is bring that toe inwards just a little bit, and you tell me if you notice a difference. Oh, yes. Perfect. Adductors, so this is strengthening of the upper leg. And again, we want that stability and strength of the muscle to offset the loading of the knee. So you're going to stand nice and tall. You're going to feel this mostly on your opposite side because it's going to take all your weight. You're going to bring your left foot towards your right foot, utilizing your core so you don't twist or rotate. And go back. Perfect. And you know what? Videoing you working on some strengthening for your quadriceps and your hamstrings. And we want to remember that our muscles must be nice and strong in order to offload our joints so we don't have that same pain. So what we're going to do is we're going to put the band under your foot. We're going to crisscross it. You're going to take a band in each hand. You're going to pull your hands up to your thighs and just rest them. And what we're going to do is we're going to breathe out as we extend our leg. And you're going to go as straight as you can. Remember, we want that nice straight knee. You're going to feel some tension in your quadriceps. After a hold of 3, we're going to slowly reduce or relax the hand in front of you and affix it to a solid surface. We have it around your foot. What we're going to do is we're going to sit nice and tall. We're going to breathe out and we're going to pull our heel towards our backside. Yeah, just lift back. Good. Go back as far as you can, holding for a count of 3, just to work on that hamstring and relax the foot in that starting position. Work on core again, and this time we're going to do it in kind of an upright position, allowing gravity to push us down. So if you think of yourself as a lovely 2x4 sitting in the hardware store, we want somebody to buy you and take you home. If you're saggy, they're not buying you, you don't look structurally sound. So we're going to place your hands on the tabletop. You're going to take your feet out, heels are going to be up. We're going to round our shoulders. Abdominal muscles are engaged, and you can bend down just a little bit just to feel a little bit of lengthening through your abdominal cavity. If it hurts your back, you need to let me know. Good. And then press back up and come to an upright position. Good. Want to feel it here. We're going to work on core muscle strengthening, and the importance of the core is it stabilizes our upper trunk while we're moving. If it's not facilitating movement, then we're using a whole lot more muscle strength. So we're going to try and make you stronger through your core. So we're going to put the ball right at the back of your thighs to begin with. We're going to try and keep a little bit of a straight knee as we do this activity. You're going to engage your core. When you're ready, and actually for you, I'm going to have you place your hands flat on the bed and you can push down. You're going to raise your backside as you push out towards the wall. Keep your knees straight, or bent, sorry, a little soft bend. Good, going to count to 3 and slowly lower back down. Wonderful. Do you know what I just realized? It's good. We're going to do the same thing on the opposite side. So, nice. Think of your hips in an elevator, going down the elevator shaft, beautiful, and come back in. Perfect. So, Carrie, we're working on positional activities. So this would be an example of reaching into the crisper of the fridge or the freezer if it's down below. And we want to do it properly and with good alignment. So we're going to try and get your foot relative to your knee, relative to your hip in the straight line. And we're going to use the slider to facilitate our opposite leg. So we're going to slide the slider back. We're going to drop down. Beautiful. And then come on back up. And let's switch feet and let's do the opposite foot. So that same alignment. Good, standing nice and tall. Controlling the inward drive of that right knee. Come back up. Perfect. You want to make sure that your feet, your knees, and your hips are all in that same line, okay? Very nice. Okay, so trying not to use our hands. We're going to take a breath in. As we exhale, we're going to push through our feet to come to that upright position. Very nice. Now you're going to lower back down, keeping the knees separate,
And remember, there's something like a carton of eggs under your backside. You don't want to squish them, so a nice controlled drop down. Beautiful, good job. We're going to remember that good tracking. When we lift our knee and we place our foot on the step, we're going to think about our knee following our hip and our toes following both. Okay? We're going to put our full foot on the step. We're going to load that foot and press upwards, bringing the opposite foot to the top of the step. Good, nice and relaxed. You're going to step down with the right foot leading. And foot returns to the ground. Excellent. Let's try with the other leg. Good, and down. Okay, with the leg.